Hello there and good morning. A radical new treatment for Parkinson's could completely change the lives of people who suffer from the disease. Trials of gene therapy, which involve a one-off injection into the brain, enable sufferers to produce the chemical they need to combat the illness. Sky's Rhiannon Mills has this exclusive report.
Okay, so very slight on this side, much more obvious.
This is Sheila Roy at a time when she'd almost given up hope.
Are you able to stand up like that?
Filmed before having gene therapy, a severe tremor and lack of balance made simple tasks impossible. She felt trapped in a Jekyll and Hyde state by Parkinson's.
Jimmy, come on.
Less than a year after having this groundbreaking new treatment injected deep into her brain, life is looking up.
People would take knives off of me in the kitchen because I was everywhere with a knife. My vocal cords were suddenly shut, so I can't breathe. If I hit a wall of people, then I can't function, I just stop. But I'm feeling that I can see a glimmer of the person I used to be now, which is really exciting.
Sheila was diagnosed in her 40s and has had the disease for 17 years. It occurs when the brain gradually stops producing the nerve-controlling chemical dopamine. So this new treatment, called Prosavin, uses a stripped-down virus to transport dopamine-making genes into the brain. Holes are drilled into the skull and it's injected deep into the region called the striatum that helps control movement. Once the virus gets into the brain cells, it reprograms them to gradually produce their own dopamine, in essence creating a medicine factory inside the patient's head.
It seems to be having an overall beneficial effect in smoothing out people's days, probably allowing a slight dose reduction in medication, and for some patients a better sleep pattern and a better quality of life overall.
This very small container gives you some idea of the tiny amounts of liquid that were injected into Sheila's head. She doesn't need any more operations, but will need further checks and scans to try and work out just how much dopamine her brain is now producing. They'll also be looking for any side effects. Safety is, of course, vital if this kind of treatment is to have a future. So far, it's only been carried out on 15 patients here in Cambridge and in France. The scientists from Oxford are already working on similar treatments for other degenerative illnesses. More clinical trials are needed before it could be available on the NHS, and this isn't a cure.
If you can treat the symptoms and control in some way the deterioration in what you can do, it has to be better for you, and it is.
So while Sheila still has her bad days, she's convinced that it's been a life changer. Rhiannon Mills, Sky News in Cambridge.
Again, Sky's health correspondent Thomas Moore is alongside me. Good morning to you, Thomas. It's about making the body's own cells work for us